Welcome to the deep dive. We are pulling up a genuinely intense stack of material this week. These are regional newspaper excerpts from the Southern California Observer Group.
Right.
And what they reveal is just this massive structural tension gripping the country right now. We're diving into sources that show a massive federal government crisis
Yeah.
colliding head on with some profound, really innovative local efforts to fix deep-seated issues in health and educational equity.
That's absolutely right. And our mission today is really to give you context and connections. We're looking at 5 seemingly disparate stories from the region:
Okay.
the shutdown, health disparities, education reform, even a crisis in journalism. And we're showing how major policy decisions like that multi-trillion-dollar healthcare fight in D.C.
Yeah.
have immediate, sometimes devastating consequences right down at the community level here in California.
And the high-stakes fight that's really dominating the headlines is the federal government shutdown. It began October 1st, 2025.
Yep.
And it's fundamentally a battle over the future of U.S. healthcare.
It really is. And what's fascinating here, is that the conflict boils down to 2 major but related policies. On one side, the immediate crisis is the expiration of the Affordable Care Act, the ACA tax credits.
Right. End of the year.
End of the year. And over 24 million Americans rely on these. That includes 2 million Californians right here.
Okay, let's unpack the weight of that. House Minority Leader Hakeem Jeffries is pretty firm, stating Democrats won't support a, quote, partisan spending bill that guts health care.
Right.
And U.S. Rep. Pete Aguilar gave a really clear example of the human cost. He said a 60-year-old couple earning $82,000 could see their annual premium skyrocket. We're talking nearly $14,000 without that subsidy extension.
Yeah, that's not just a budget line item, is it? That's an immediate, unsustainable financial emergency for millions of families.
Exactly.
But the conflict is also about deeper cuts. Democrats point to the president's One Big Beautiful Bill, signed back in July.
Ah, yes.
And this bill introduced massive cuts, basically designed to offset tax breaks for the wealthy.
And the sources show those cuts are enormous, up to, $1 trillion slashed from Medicaid?
$1 trillion, yeah, from Medicaid, which is Medi-Cal here in California, and also from food assistance programs. That cut alone, if enacted, could cause 15 million Americans to lose health coverage,
Wow.
including 3.4 million Californians. And the CBO, the Congressional Budget Office, they project 4 million people will go without coverage next year, just from the ACA subsidies not being extended.
And extending those subsidies, just for context, would cost about $350 billion over the next decade.
That's the figure, yes. $350 billion over 10 years.
So on the other side, the Republican side, House Speaker Mike Johnson says Democrats reopen the government first.
That's the line.
President Trump has been vocal, claiming Democrats are causing job losses with the shutdown, and they push back heavily on the cost,
Right.
arguing extending the subsidies would cost Americans over $1 trillion, which is a figure Democrats obviously dispute.
Fiercely dispute, yeah. And this is where it gets complicated by sort of regional politics, too. The White House claims Democrats want to use a, quote, loophole
A loophole?
to redirect federal money to pay for health care for undocumented immigrants in California. Former Fox News host Steve Hilton has supported this claim, citing a Medicaid provision.
But Governor Newsom denies this.
Strongly denies those specific assertions, yes.
Okay, but here's where it gets really interesting, because the timing seems to be the political weapon.
Exactly.
Congressman Aguilar points out that the deepest cuts in that big, beautiful bill, the $1 trillion Medicaid slash,
Yeah.
aren't actually scheduled to take effect until 2027.
Right, 2027. And what's fascinating is the alleged political calculation here. Aguilar argues in these newspaper excerpts that this timeline was specifically designed to insulate Republicans from political fallout before the 2026 midterms.
Oh, okay. Pass the bill, avoid the pain during the election cycle.
And have the cuts hit afterwards. That's the alleged strategy.
But so what is it? This political strategy seems to have backfired immediately.
Right.
Because health insurance companies, they have to set premiums now. They can't wait.
Exactly. They have to price in the projected loss of subsidies and those future Medicaid cuts. They're factoring that massive future pain into today's prices.
Which leads directly to those immediate, staggering premium increases for consumers. So the system is reacting to 2027 cuts right now in 2025.
Absolutely.
Yeah.
And while D.C. debates the timing of the pain, The real-world effect of the shutdown itself is immediate. It's palpable.
Yeah.
We're seeing furloughs, layoffs, reduction, or even halting of activities at critical agencies. Think about the CDC, the NIH,
Crucial health agencies.
even places like the National Park Service.
Yeah.
All these public services paused because of a policy disagreement miles away.
That structural failure in Washington, it sends us right back to the community level, doesn't it?
It really does.
Because if the federal government is trying to pull back the safety net, local communities are left trying to invent new ones. Let's pivot from those national policy battles
Okay.
to a grassroots approach to health equity. Because the local data on health disparities in California, particularly around diabetes, it's shocking.
The crisis data we sourced is truly alarming, and it really underscores why preventative care is so vital. You look at diabetes diagnosis rates.
Yeah.
They're nearly double for low-income adults. We're talking 1 in 6 adults at the lowest income level.
1 in 6 compared to
1 in 11 at the highest income level.
No.
And age just compounds this. More than 1 in 5 older adults, 65 plus, have diabetes.
And this isn't just about managing a chronic disease. It's about devastation. There was a HERE study.
Yes, the Health Equity and Economic Resilience Study.
Right. It mapped patients with diabetes who had amputations in California. And it found patients in low-income ZIP codes are far more likely to need lower limb amputations.
Literal amputation hotspots,
But-
directly correlating to income.
And the statistic that just stops you in your tracks,
75%.
75% of those amputations are preventable.
Preventable. When we talk about systemic health policy failure, that's what we mean. And the disparity hits the Black community hardest.
How so?
African Americans have the highest amputation rate in the nation. And the mortality rate for a high-level amputation is devastating, 50% within 3 years.
50%. That's a life or death statistic rooted in lack of access and prevention.
Absolutely.
But that necessity is driving some incredible local solutions. We see podiatrist Dr. Bill Relaford stepping way outside the traditional clinic model. He started the 250-acre Bloom Ranch in Acton in 2023.
Which is the largest Black-owned farm in L.A. County. And its mission is, well, it's radical.
Oh, so what's he doing?
Dr. Relaford is focused on finding, quote, avant-garde ways to bypass the broken systems
Okay.
and make fresh fruits and vegetables accessible in L.A. County food deserts. He's shifting the focus from treating the illness after it hits to actively prescribing prevention through nutrition.
How does that actually work in practice? Prescribing vegetables?
Yeah, it's about integrating farm-based wellness directly into healthcare planning. He plans to partner with major institutions like UCLA and Charles Drew University
Okay.
to develop what they're calling prescriptive vegetable boxes. So the idea is, instead of maybe just a drug prescription, patients might get specific produce known to help their conditions, like beets, turnips, dill, basil, garlic. They've been shown to naturally lower blood pressure.
It's like an end run around the food access problem.
Right, exactly.
And beyond just the nutritional benefits, the sources even mention the psychological and physical benefits of gardening itself.
Oh, yeah, definitely. Things like vitamin D, microbes in the dirt, boosting the immune system.
Less stress, decreased dementia risk. It really is a holistic approach.
It is. But this kind of grassroots innovation, it's running head-on into lagging government policy.
Oh, so.
Liz Helms, who's the CEO of the California Chronic Care Coalition, she says state-backed prevention policy is in, quote, horrible shape, especially in underserved areas.
Horrible shape. Wow.
Yeah, and she emphasizes the need for patient empowerment, getting patients past that fear of the doctor, understanding their baseline health,
Right.
and insisting, really insisting, they have a right to good, quality, affordable, timely health care.
So if we know chronic disease and health access is tied so deeply to environment and income, what happens when that same inequity hits the classroom?
Ah, good transition.
Let's look at 2 new California laws aimed at improving educational outcomes, trying to reduce those systemic barriers, moving away from, those painful chronic illness stats.
Exactly. Because health equity is just inextricably linked to opportunity. And opportunity often starts with education.
Right.
So the first law is AB 1230, the Expulsion Rehabilitation Plan Reform, signed by Governor Newsom October 3rd, authored by Assemblymember Mia Bonta.
And what does it do?
It directly attacks structural barriers. It mandates that school districts must help expelled students access resources.
Like money or transport.
Exactly.
Right.
Addressing financial or transportation barriers so they can actually complete their rehabilitation plans.
Yeah.
And crucially, it limits extending an expulsion term to just 1 additional semester at a time.
Okay, so the goal is
The stated goal is interrupting the school-to-prison pipeline,
Makes sense.
and the data behind it is devastating. In the 2023-24 school year, 8.6% of black students were removed from classrooms. Suspensions, expulsions,
Compared to white students.
compared to 2.7% of white students. And the sources highlight black foster youth specifically.
Yeah.
Lost an average of 121.8 days of instruction per 100 students just due to suspensions.
Over 120 days. That's huge.
It's massive lost learning. This law is an urgent attempt to recover those days.
Okay. And the second law, AB 563.
Right. Authored by Assemblymember Corey Jackson.
Yeah.
This one addresses the pipeline much earlier, early childhood. It enhances oversight of the Early Childhood Policy Council, the ECPC. It requires their annual report to the legislature to include detailed data analysis, specific successes, challenges, gaps.
And actionable recommendations.
Exactly. Actual recommendation. This law is all about tackling the fragmentation of California's early care and education system.
So it's trying to smooth things out.
Yeah, the goal is to ensure data-driven solutions are presented to lawmakers to better serve diverse kids and guarantee smoother transitions into the K-12 system. It's about systemic equity right from the start.
Reinforcing the gains hopefully made by AB 1230 later on.
Precisely. Trying to fix it at both ends.
Okay, so we've gone from D.C. policy fights to local health farms to education reform. Now we need to step back and analyze who is telling these stories.
The messenger.
Exactly. We need to talk about the crisis of the black voice in journalism because the messenger absolutely shapes the message.
And the immediate case study that really sparked this alarm recently was the dismissal of Karen Attia.
From the Washington Post.
Right. Until recently, their only black female opinion writer. She was terminated after social media posts where she addressed violence and white extremism.
Which started a huge conversation about who gets to speak critically in major newsrooms.
A huge conversation. And the data just underscores how fragile that representation is. Pew Research Center found only 6% of reporting journalists in 2022 were black.
Only 6%, even though black people make up 12% of the population.
Exactly. Contrast that with white journalists, 76% of reporters versus 61% of the general population.
So what's the impact of that absence?
Well, the National Association of Black Journalists, NABJ, President Erin Haynes put it starkly. She said the absence impoverishes the entire profession.
Impoverishes it how?
Her argument is, when those voices are missing, stories go untold, perspectives go unchallenged, and the truth remains incomplete.
And Philip Lewis from the Washington Association of Black Journalists, WABJ, warned that Attia's firing sends a, quote, chilling message.
Yeah, that black perspectives are only valued if they align with the status quo. That's the fear.
And this feeds into a known issue, right? The clustering issue.
Absolutely. Black journalists are most visible, covering social issues and policy, about 15% of those reporters.
Okay.
But they are scarce in politics, the economy, science, technology, those core beats.
Which means many of our national conversations about power, wealth, the future, they're being filtered primarily through a single white lens.
Right. And Professor Khadija Costley-White explained the consequence perfectly.
Yeah.
She said, when you disappear people from these critical spaces, politics, economy, science, you lose.
You lose what?
Valuable discussions that help our nation really process who we are and what kind of country we want to be. The ability to even discuss a shutdown's impact on certain communities or why an equity bill is necessary. It depends entirely on who's writing the story.
So it all connects back.
It really does. To synthesize the powerful themes we've explored today, we move from that high-stakes, multi-trillion-dollar federal fight over health care
Complicated by political timing.
to community-level health innovation, trying to save lives from preventable amputations. Then we looked at critical education reforms aiming for equity, and finished by examining how all these stories get filtered through a media landscape that's struggling profoundly with basic representation.
So what does this all mean for you listening? I think it reveals that the fight for health and opportunity is being waged simultaneously, but at two very different speeds.
Yeah.
On one hand, you have Dr. Relaford's Bloom Ranch, inventing solutions, showing incredible community resilience.
Finding ways around broken systems.
Exactly. And on the other hand, you have the government shut down this huge structural fight where the true cost of these policy debates is ultimately measured in, well, lives, rising premiums, and lost school days.
The sources really show us communities finding innovative ways to bypass systems that seem to be failing them.
Definitely. So here's a final thought to leave you with. We know those big healthcare cuts in the president's bill are set for 2027. But the health crisis driven by insurance premium hikes, That's happening now.
right now.
So what stands out to you about that political calculation, pushing the pain into the future? And maybe more importantly, how can grassroots solutions like Dr. Elliford's farm possibly scale fast enough to meet the immediate health needs caused by a federal structure seemingly designed to defer accountability?
That's a tough question.
It is. That's a deep dive for you to consider.